This week on the Big Story Podcast, millions of people who can't afford their health care costs.
My dentist said it's like $150 per tooth, so that'd be like $2,800. I can't, no. Can't afford that.
Risking bankruptcy by going to the hospital.
Holy, I never even saw that, oh my God. $22,000 for one treatment of proton therapy, and I need 15. I would say overall, I probably have about $100,000 in debt.
Dependent on insurance to avoid financial ruin.
Medicine in this country is broken. They're not going to help you. They want you to sell everything you have.
Triage, healthcare in the U.S. This week on the Big Story Podcast. Hi, I'm Joe Zarinko, a producer here at Big Story. The United States is a world leader in medical advancement and innovation. But the colossal cost of top-notch, cutting-edge healthcare forces many patients to have to choose between going to the hospital or going broke. 97 million American adults are uninsured or underinsured. That's according to the Kaiser Family Foundation. Most of the middle class struggles to pay bills when they become seriously ill, and 1 in 4 cancer patients has to declare bankruptcy or sell their home to pay for treatment. Correspondent Toby Muse traveled to Appalachia, a mountainous region of the U.S. where poverty rates are high, to see how residents are faring with health care firsthand. This week's Big Story Podcast is called Triage, Healthcare in the U.S. America spends 1/5 of its GDP on healthcare, but it comes at a staggering price to patients. In the rural mountains of Virginia, where residents are often short on cash, they need to rely on the kindness of strangers for treatment. Teresa Tyson helps provide the treatment.
Times have traditionally been very hard here in the central Appalachian, all up and down the Appalachian region. It's like forgotten.
A nurse practitioner, Teresa and her staff are traveling the rolling hills of Appalachia in their nonprofit Health Wagon to provide compassionate and quality hospital care at a health fair.
The success of this nation was born on the backs of the coal miners here. And it's just like, so many times I feel that they've just been forgotten. They are a population, it's certainly been disadvantaged over the year, but maybe one day we wouldn't have to have like the event like they were getting ready to, experience this weekend, where people have to come up and they have to line up for health care. I'd like to see one day when that, doesn't have to be anymore.
Today, Teresa is teaming up with the Virginia Dental Association to bring $2 million in medical assistance to the communities underserved. Before the event starts, she briefs her staff.
The individuals will, park up here. They will come in. The dental will go to the right. To the left will be our medical and the vision. So when they enter there, they will go into the red grandstands in here, and it will be a holding area. We want to screen everybody for Medicaid. We've expanded Medicaid in the state of Virginia. A lot of people don't know they're eligible for it, so we want to get them in for insurance. And the reason that's so important is because, one trip to the hospital or one catastrophic event could bankrupt these individuals. Here in the United States, I think that we have a wonderful healthcare system in certain regards. So maybe if you have a catastrophic occurrence in your life, say maybe you're in a car wreck or something like that, that you need to be, in ICU. We've got that is wonderful, but I don't think it's so much on like the prevention and just primary care. We're going to make a lot of difference in a lot of people's lives. And I really feel that it's because of this event that we're changing that trajectory of negative healthcare disparities here in Southwest Virginia, because it's all these wonderful, wonderful volunteers, everybody, you know, working from the heart. So that's what the Health Wagon is all about.
Thousands of people travel hundreds of miles to attend the health fair for free. Ashley Mullen is one of them. She consults with oral surgeon Dr. John Harris about dental extraction.
I noticed that my x-ray shows that my top teeth and stuff are good, but I can't brush them without them hurting, so I'm trying to just get them removed. I know they look good enough not to remove, but like I said, last year they couldn't even clean them without them numbing me like 20 times up here.
So, did it bother you when you brush your teeth?
They hurt all the time.
So, what causes that? Is it?
I don't know.
So, they've talked to you in the past, this last year, about. Do you understand why we were trying to keep them?
I do, but they, like I said, they can't even clean them without having to numb my whole mouth.
After her consultation, it's decided that Ashley will have every single tooth removed.
I was nervous because last year I didn't really get a dentist that listened to me. And this year I got a dentist that was really nice and actually said that, you know, he wanted to do what the patient wanted. And so I'm getting all my teeth pulled.
Ashley's mom, Sheila, is attending the health fair with her.
I used to brush them really good. Like I'd brush them in the mornings and then I'd brush them after lunch and then when I ate. Well, as I got older, I was like, nah, I don't feel like doing this no more.
I think a lot
she got me
was her medications that she was on. You know, a lot of medicines, they deteriorate our teeth, gums and all. But I think that was pretty much a lot of her problem. How you feeling today?
I'm nervous. I never went through this. Went through maybe getting 2 at a time, but not 28. But I'd rather get them pulled now than them just keep hurting and hurting and hurting. And I won't have a toothache no more. Might have a gum ache for a while, but I'm excited about it, but nervous all at the same time.
I'm just glad they're here to do it, you know.
Yeah.
Because that cost you a lot of money.
Oh, yeah. It's
if you had to pay it out of
$150.
pocket.
My dentist said it's like $150 per tooth, so 28, that'd be like $2,800. I can't, no. Can't afford that.
The next day before the surgery, Ashley consults with the nurse and oral surgeon Sean Eccles, who will be performing the procedure.
My mom has dentures. My stepdad has dentures.
Okay.
So it runs in my family, and I've took a lot of medicine over the years, which has killed my teeth.
Oh, that could be a big part of it, right?
Yeah. Yeah, a lot of the medicine, I've been taking medicine since I was like 12.
There's a chance we find a little hole up here. We're going to stitch that closed if
Yeah,
you see it. And
that's
just have to
fine.
follow some instructions for a couple weeks.
Yeah.
You're going to be sore. You're going to swell for a couple of days. You may bruise. All right. We'll have to see how you do. Any
Okay.
questions about anything?
Nope.
We talked with oral surgeon Sean Eccles about Ashley's situation.
This is something that probably would have been close to $10,000. Some, depending on where, probably $5,000 to $10,000. And that's something that is really, again, just kind of the system in this country, not very attainable for a lot of people. If you have dental insurance or know about dental insurance, a lot of things are covered, but they tend to max out around $1,000 or $1,500 or so. It's a shame to be in a position where you're kind of facing edentalism or losing all your teeth and going into dentures before the age of 40 is suppressing. You know, that's a really big challenge. People don't realize when you're going into a denture, you are losing a part of you and getting a prosthetic, which is very daunting to think about getting a prosthetic limb. And I think a lot of people who struggle with dental pain don't really make that connection that you're going into a prosthesis.
The tooth extraction procedure lasts 3 hours. Once the surgery is complete, Ashley's stepdad greets her in recovery.
He kept telling me, oh, it don't hurt, it don't hurt. You lied.
Dr. Eccles says it's disheartening to see young people lose all their teeth. Ashley is only in her 30s.
When you lose all your teeth, it makes you look older, right? Because you collapse, the jaws kind of collapse down. So at this point, I'm not the hero. I just got her out of disease and pain. But really, when she gets her prosthesis, that's when she's going to see that difference. And she's going to have her teeth back. It's going to restore that proper shape to her face, give her teeth to smile with, and of course to eat with. And I think at that point, she'll be much happier.
For most people in the U.S., health insurance is attached to a job. Coverage ends once a person stops working. Amanda Woodrow is a cancer patient who lives in Baltimore, Maryland. We caught up with her on her way to meet with her support group.
I'm originally from New York. I was born and raised there. So I moved here. I've been in Baltimore for like 25 years now. I started working at my company back in the early 2000s. We did mortgages then, and then everything happened with the mortgage market in 2008. Then we switched over to real estate. And then in 2023, out of nowhere, I was diagnosed with this advanced aggressive cancer, which was just shocking. And it was just, totally out of nowhere. We're going to the cancer support group, Baltimore Cancer Support Group over in Baltimore County. I started going when my mom was sick back in either 2012 or 2013. Then I just stayed part of the group. Normally we just will go around the table and everybody will catch everybody up kind of on their week and what happened and, if you got news about treatment or, whatever it is.
The cancer support group is led by an oncology nurse named Karen Howie. Tonight, she's brought conversation starter cards to help the group discussion begin.
I found these on Amazon, so the icebreaker, and every week somebody different's going to pick one. It's just nice because it kind of breaks the ice a little bit. We get to know everybody's name, your groups. So tonight was Steve, and that's why it was a terrible question. 170 questions, and he picked up, do you want to know when you're going to die? Needless to say, he'll never get a chance to pick one again.
I would like to know, because I wait till the last minute.
Yes, I would like to know, maybe to, say goodbye for some friends and family members.
And I would not like to know. I just go forward, just live.
I really don't think I want to know, but you know what? Is there negotiation? Can you just be tipped off it's going to happen soon?
I wouldn't want to know. I don't want to know my mortality with the cancer. And, that feels like enough mortality itself that no, I wouldn't want to know. I would spend every day anxious counting down till the end. It would be awful. No. It's a great group. It's great just to know that people are going through what you're going through, that people understand it. It's a good place to get resources of different doctors in the area or different, I've been able to tell people different financial, charities and stuff that you can get help from and things like that.
Curtis Martin is a member of the support group.
If I can remember correctly, the oral chemo drugs, which came from a specialty pharmacy in Florida, was, I think, $30,000 a month. And when they told me how much it was, I need the meds. I certainly don't have $30,000. I was able to, through the social worker at the hospital, I was able to get a grant that covered the $30,000 figure, but $30,000.
And they actually have a program, and as long as you qualify, you can't have a lot of money.
Yeah.
As long as you're a little bit low middle class, you can get help. But if you make money, you're screwed. They're not going to help you. They want you to sell everything you have, and that's why we had to retire. It's now medicine is insurance dictates. Your insurance company will determine if you get treated or if you don't. Medicine in this country is broken. If you have no insurance, you can apply for it to help pay for all your care. If you have insurance, they will not help you. But you have to have zero insurance. So for you, you could not get help through this.
I met my husband, my late husband, through the cancer support group. He came for himself. He had colon cancer, and we met and dated and fell in love. We got engaged in 2015, and we're planning an October 2016 wedding, when in the summer 2016 he took a turn for the worse. So we did a quick, we did a courthouse wedding, but then we threw just like a big, like, kind of wedding cookout in our backyard and had everyone come from all over the place, and it was beautiful. Everyone from the support group came. It wasn't the wedding we were planning, but it was still a gorgeous wedding, and he hung on for that day. He died 5 days later in our house right next to me.
The cost of Amanda's treatment is exorbitant. She constantly needs to monitor her medical bills on the computer.
Laboratory services. Again, this is all lab down here. Holy, I never even saw that. Oh my God. $22,000 for one treatment of proton therapy. For just one treatment, and I need 15. I would say overall, I probably have about 100,000 in debt. I decided early on, though, that I didn't care what the cost of things were, that I was going to get whatever treatment I needed to get, whatever was the best treatment they recommended, regardless of the price, because you can't ruin a dead person's credit. And so if I'm dead and I paid all these bills, it's great, who cares? But if I'm alive, at least I'm alive with debt, you know? So I decided then that, like, the thing with the surgery, that cost and everything, I was like, just whatever it is, you know? We're just gonna do it and deal with the aftermath afterwards.
Amanda also spends a lot of time on the phone trying to get answers from her healthcare company. It's a system that's hard to navigate.
Good afternoon. How can I help you?
Hi, yes, my name is Amanda Widrow. I have an issue going on where they're saying they're not covering a service that I previously had covered.
Okay. So the reason I'm asking you to reach the sales department, but let me get you with member services so they can check on coverage for you.
Okay, thank you.
How can I help you today?
Hi, yes. My name is Amanda Widrow, and I have a current policy with you guys. There's a service that I've been receiving, and the medical office is telling me that you guys are no longer covering the charge.
Let me get you connected to the right line. You did end up in the large group employer line, but let me get you connected, okay?
Okay, thank you.
Yeah, of course. So you're going to hear some music for a couple minutes. I'll comfort you over there.
Thank you.
Yeah.
If it's not cold, it's another thing.
Good afternoon. How may I assist you?
Yeah, I was giving you a call because I have a current policy there. I've been a policyholder for like 10 years now, and you've always covered my nutritionist, and I'm being told now that you guys are rejecting claims from them.
Okay. So let me actually get you over to the department that handles your plan.
I thought that was you. They transferred me from the last department to you, no?
No.
Yeah. This is my third transfer. This will be the right department?
Okay, yes.
I'm probably the best insured you can be, like one of the best insured you can be, and it still is underinsured, even though like technically it's not somebody like, I do have a $1,700 deductible, but there are people with $5,000 deductible. So yeah, there's still money that always has to be paid out of pocket. My husband, when he was going through it, he worked for the government, the federal government, the USDA. He had good insurance through them. He did not pick the lowest plan. He had to pay $10,000 every year before he got 1 penny of treatment once he had cancer. If you sign for somebody else's medical benefits, like your child's or a husband or a wife, they will hold that person responsible. So I never signed anything for him. And what I did after he died was I kept a box, and we got bills and bills and bills. And so I would just throw them all in the box. I think I kept that box for about 3 years. I was never contacted. The estate was never contacted, and I threw the box away. So I did not incur the medical debt. I guess they ended up writing it off. But he had thousands and thousands of dollars of medical debt. Yeah.
Back at the health fair in rural Virginia, Health Wagon co-founder Paula Hill Collins continues to help doctors test and treat patients.
just checking on you. Have you had anything to eat at all today?
No, ma'am.
Okay, you want a banana?
Oh, sure.
Okay. Now, how are you feeling right now? Are you having any jitteriness, any shaking, anything like that?
Yeah, I've got earthquake going on.
Okay. Did you see the doctor?
Which one?
Today, Dr. Culp, did you see him?
The Santa Claus looking guy?
Yes.
Yes.
Yes. Okay. Did he change your medicines any? Okay, good. Do you need to get any of your medicines?
Not right now.
Okay, now before you...
The metformin I quit taking. I just quit taking it. It gave me a metal taste in my mouth and I just stopped taking it.
Okay, now we are at Pound, our mobile van is, the second Tuesday and fourth Tuesday of every month.
Okay.
If we don't get your blood sugars controlled, then you can end up with kidney disease, blind, because...
Dr. Virus gave me the metformin.
Okay, good.
Yeah, but when he went to Hayside, it's a little hard for me to get over there to see him.
Right.
But
now, we're mobile, and we just want you to be taken care of, okay?
Later, Paula and Health Wagon co-founder Teresa Tyson review the results from the medical testing done at the health fair.
All right, so we're going to start reviewing all the labs. Herrick, have you got some of the EKGs?
Yes. And we have ultrasounds here, too.
So I guess we're just going to take them like case by case.
Can we see if it's back? Because I was worried about her because she became really sick while we were there. And I wondered if her blood sugar is dropping, and that can be an insulinoma too.
Yeah.
It could just be a blood sugar drop because she did say I brought her a snack. But I'm just thinking I want to see what it looks like, and then I want to make sure there's not like an insulinoma, and we can just do an insulin level.
Yeah.
April, are you able to hear me now?
Can you hear me?
I can hear you. Thank you so very much for taking my call. One thing that I was really worried about was that you become so sick when we saw you this weekend, and I want to make sure that you know to come and see us the second and fourth Thursday, okay? CJ Ratliff is usually on the bus, but if not, I'll be there. Now, one thing that happened is your blood sugar had dropped down low, and we're not sure why it did. I would like for you to be back in and see me sometime this week. I won't be in tomorrow.
Well, Friday will probably be the better thing for me.
The tests that we are given, like the echocardiograms, if she goes to the hospital, that's $4,000 or $5,000. She has no insurance. If I go to have surgery, I had to have gallbladder surgery, I had insurance. I'm still getting bills that I don't know where they're coming from. So I don't know how people survive, really. Why aren't they keeping the American people healthy? Why aren't they keeping our workforce healthy? This would help develop our economy. I think that when we look at liberty and justice for all, that's not liberty and justice for all. If you're telling someone, sorry, your blood pressure's sky high, but just keep working until you fall over and then we'll put you on disability. Makes no sense, because then the government is still paying out all this money to keep someone who may have been able to stay in the workforce to be able to help them to live. Our system is just really messed up right now. And like I said, I don't know. Teresa and I both try to, as our mentor before us, Sister Bernie did, we talk, we scream as loud as we do, and sometimes we get slapped on the wrist for that.
Cancer patient Amanda Woodrow has thoughts on the U.S. healthcare system after her medical experiences as well.
So yeah, I would definitely say universal healthcare is what we need. We need everybody in this country to be covered for all major events. I think it's definitely the pharmaceutical companies driving up the costs and the medical companies and just the way everything, I don't know the intricacies of it, but I know it shouldn't be this expensive. It shouldn't be.
The U.S. is among the world's rich nations, yet it also has the lowest life expectancy. On average, each citizen spends more on their health care each year than on food for an entire household. That's all for the Big Story podcast this week. Special thanks to our colleagues Caleb Lopez and Felipe Lozano Puche here in our CGTN America studios. If you want to check out the full-length documentary, we'll drop the links in the show's notes, or you can just go to CGTN Now on Apple TV. Thanks for listening.